A bank in Louisville, Kentucky, a beach party in South Carolina, a school in Nashville. These are just some of the highest profile mass shootings of the past month. The Gun Violence Archive reports at least 148 mass shootings of 4 or more victims have been committed so far this year. And that number is expected to grow as politicians remain divided on how to solve the crisis. In the aftermath of the Covenant School shooting in Nashville, a mom who survived the July 4th shooting in Illinois went viral for taking over the microphone at an official briefing to call for change.
Aren't you guys tired of being here and having to cover all of these mass shootings? How is this still happening? How are our children still dying, and why are we failing them? Aren't you guys tired of this? Are you guys sick of it?
And experts say it is tiring. These mass shootings weigh on our mental health, and it's a uniquely American problem. I want to bring in clinical psychologist Wizdom Powell, the Chief Social Impact and Diversity Officer at Headspace Health, and psychiatrist Dr. Janet Taylor for more on this. Wizdom, you say these incidents affect us even when we are not directly involved. Can you think of any examples or stories about how that can manifest?
Well, good morning, Diane. It's great to be here, but not under these circumstances. Here we are again talking about gun violence in our nation. We do know for sure that secondary trauma or secondary exposure to mass shootings can elicit some of the same symptomatology that we see when an individual has observed that up close and personal. This is rare, but it is probable. And what that manifests, how that manifests rather, is as symptoms like nervousness, hypervigilance, feeling more depressed or down or anxious than usual. The reality is that even bearing witness to these events can exact a toll on all of our mental health, especially when we don't have support in place or resources to help us cope with or metabolize those experiences.
Now, Dr. Taylor, it's especially hard to talk to children about mass shootings. What are you seeing in the children that you interact with, and how do you recommend that we talk to our kids about this?
Well, it's important to understand that almost 70% of U.S. citizens, including children, have had some sort of exposure to trauma or will. And when you add this factor of these mass shootings that happen, and really, in my opinion, are like terrorist attacks. They usually happen when people are going about their normal business, going to school, going to church, shopping in stores, and children are aware of it. They have exposure through television, and they ask questions. So it's really important that we talk to kids really based on their age, but understanding they're watching, talking about what if situations. If you see something, someone has a gun, what do you do not only in school with practice, but if there are someone's houses, especially as we are loosening laws about who can carry a gun, and just always check in with them every single day in terms of, has there been anything that you've seen or heard that has bothered you? You can always talk to me about it, because as parents, we need to be the trusted source for them. But check in on your kids early and often, because they are bearing witness to all this and are feeling stressed and in many cases traumatized.
Wizdom, after these shootings, there's a trickle of information. The immediate facts of what happened, how many people were killed or wounded, that kind of thing. Then we learn more about the victims and about the shooter. Then we sometimes will see, video of the encounter or hear a 911 call audio. Is that information good or bad for our mental health? Because in a way it feels traumatic, but in another way, there's a certain level of comfort that comes from feeling like your questions are being answered.
Well, first of all, we all have a desire to know more when these events happen, because they so shake the fabric of our sense of security that we're compelled to want to ask questions and to scroll and to learn more. But doom scrolling, as we know, looking through the news, stories over and over again, can be compromising to some people's mental health. So the important thing is to know your limits. Know that you can turn off the information, turn off the television, shut down your social media, so that you can have the time to recalibrate. I do think that overexposure to this information, particularly what we're learning from research studies that are showing that individuals who have watched these kinds of incidents online are actually bearing the signs and symptoms of post-traumatic stress disorder, should be a clear sign to all of us that absorbing this information comes at a cost. The important thing is to create healthy boundaries around yourself so that you're not taking in more of this information than you need to, and also balancing that with something more hopeful in this moment, and helping us all to feel a little bit more predictability about, what is possible.
Now, Dr. Taylor, we also often hear questions about the mental health of the shooter in many of these cases and the need for more help for people in crisis. The family of the Louisville gunman, for example, said that he had mental health challenges, but there were never any warning signs or indications that he was capable of something like this. So what more needs to be done on that front?
If you are someone who has mental health issues or knows family members, get treatment. Help is out there, whether you're underinsured and uninsured. Certainly, if someone has weapons or makes threats, take that seriously. Contact the police, let an authority talk to them, take their guns away, and certainly examine their mental health. But the bottom line is, in some cases, yes, you can predict who may be violent, but in many cases, it's impossible to predict who may be a mass shooter or perpetrator. So we need to shore up our mental health, make it accessible. If you notice a warning sign, get help, lose the stigma about it. And it really is about preserving our mental health, the mental health of the shooter, and keeping everyone safe. So if you see something, say something and speak up.
Now, Wizdom, the federal gun reform law passed after the Uvalde shooting last year allocated funds for mental health resources, among other provisions. So where do you think that funding can make the biggest difference?
Well, first of all, I'm an advocate for prevention. And, the reality is that mental illness is not the cause of gun violence. The United States has similar rates of mental illness to other countries, and yet we still have so much higher rates of gun violence. In America, the firearm homicide rate is nearly 25 times higher than other high-income countries, and overall gun deaths are over 11 times higher. This should be a wake-up call to our legislators, and how we direct that funding will matter the most. We are increasingly seeing a deficit in our capacity to provide preventive, real-time, preemptive mental health care for individuals across our nation. We have to shore up those systems and structures so that we can address this emerging crisis and help individuals who are struggling with some of the issues that the shooter that we're talking about today obviously struggled with. But this is a wake-up call to all of us.
Dr. Taylor, we often talk about, talking to our kids about these things, but our executive producer, not long after the Nashville shooting, got an email alert that someone gained access to his son's school. Thankfully, everything turned out okay. The security guard, buzzed in the wrong person. But you get an email like that and you panic, understandably. It's almost like we're programmed at this point to assume the worst. So aside from talking to our kids, how do we manage our own emotions and fears around this issue?
Well, it's key because we know stress rates are going up. And so it's really important that you practice how to take a breath and take that self-pause, understanding that our brain does not like uncertainty. And when faced with uncertainty, we'll go to a worst case scenario, which can make us feel more anxious and depressed. So focus on what's under your control. Take in the fact of how you do keep are safe. Remind your children how they're safe. Practice drills. And so it's so important to understand that there is always hope. So find it.
Wizdom Powell, Dr. Janet Teller, always great to have you on. Thank you both.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.